So it's nice to meet everyone. My name is Dr. Guo. Like Lori said, I'm one of the sleep medicine fellows at the University of Michigan. My background is family medicine, and this is something I see a lot in my practice. I see a lot of pregnant patients, so I felt really excited to do a presentation on this sleep during pregnancy. So, the aim of this presentation is to inform and to alert people. It's by no means a substitution to see your own physician. So I'm not giving medical advice during this presentation. So why is it important to talk about pregnancy and sleep? Well, there's a few reasons. I feel like pregnant women don't talk about their sleep problems. During their prenatal visits, there's a focus on so many different things, so many things to get through that a lot of times sleep is not brought up. And what I found is that unless I directly ask my patients about their sleep, they don't really complain to their doctors or to their midwives about their sleep issues. And even if they do, a lot of times these problems are often ignored during pregnancy. A lot of people chalk it up to, oh, you're pregnant, it'll get better after you deliver, it's normal, but it's actually, it's definitely worthy of a investigation as to why you're having sleep problems, especially during pregnancy. And the last reason is that it is extremely prevalent. The National Sleep Foundation's poll found that 78% of women reported more disturbed sleep during their pregnancy than any other time in their lives. So this is very much under-recognized, but super prevalent. So sleep duration during pregnancy, how much sleep should you be getting? So there has been a lot of research out there that has shown that if you are getting less than 7 hours of sleep during pregnancy, there is an increased risk of gestational diabetes. Less than 6 hours, you're actually at an increased risk of depression as well as the diabetes. And then if you're getting less than 5 hours of sleep a day, there is an increased risk of gestational high blood pressure, which goes hand in hand with this term called preeclampsia, which is, it's feared by all OB and family medicine physicians in their pregnant women. In general, short sleep time increases the risk of premature births. It increases your chance of having your baby stay in the NICU. But it also increases your risk of having a C-section as well. The other thing that's really hard with sleep during pregnancy is that every trimester, sleep patterns are changing, and that does make treatment more difficult as well. But in general, the pattern is that in your first trimester, you feel very tired. You feel very fatigued during the day. And as a result, you're taking multiple naps throughout the day. There's obviously the feared nausea and vomiting of the first trimester, which definitely also affects your sleep. And then curiously, you also start going to the bathroom more with more frequent trips of urination. And that typically disappears your second trimester, but then it comes back with a vengeance your third trimester. So in the second trimester, with the elevation in hormone levels, you do have more nasal congestion as well as rhinitis. Which does lead to more snoring, and then obstructive sleep apnea, which I'll talk about in a bit. And then you start feeling a lot of fetal movement, which also disrupts your sleep. It can wake you up from your sleep at night. In your third trimester, there could be a lot of pregnancy-related symptoms, such as pain, Gerd. All of these things can keep you up or prevent you from sleeping soundly. And then obstructive sleep apnea. And then there's also something called restless legs that could also be keeping you up and preventing you from falling asleep. And lastly, the third trimester is infamous for the period of time where you're just, you're not sleeping a lot. There's a lot of decreased total sleep time because of all these issues. So the three main causes of poor sleep in pregnancy, the first one that I will briefly touch on is obstructive sleep apnea. The second one is restless leg syndrome. And the third is insomnia. So with obstructive sleep apnea, for those of you who don't know, it's basically a obstruction in your upper airways multiple times in an hour throughout the night, where you're not breathing right. You're not getting enough oxygen to your brain, to your heart, to your body. And as you can imagine, if you're not getting enough oxygen to all these vital organs, you're stressing the body out, which predisposes your likelihood of developing heart disease, diabetes, dementia, all these, serious health implications in the future if it's not treated. However, with pregnancy, for a healthy female who was not pregnant, who does not have obstructive sleep apnea, she can very much develop obstructive sleep apnea during pregnancy. And there's several reasons for that. The first one is, the gravid uterus. You're basically gaining a lot of weight, which puts you at an increased risk of obstructive sleep apnea, but also this pushes up on the diaphragm, shortens the trachea, the breathing tube, and you also have increased edema in the upper airways, which also causes increased obstruction, as well as a change in hormone levels that facilitates all of this. So obstructive sleep apnea, the prevalence in very early pregnancy is 3.6%, but this can go as high as 26%. So 1 out of every 4 females in their third trimester has some degree of obstructive sleep apnea. And just to, sorry about that. I just wanted to briefly touch a bit more on the obstructive sleep apnea. So you may be wondering, so what are the effects of untreated obstructive sleep apnea in pregnancy? And there's actually several. You could have a early birth. Your baby could be preterm. Your baby may need to stay in the NICU. As you can imagine, if you're not getting enough oxygen to your body, your baby may not be getting enough oxygen. And as a result, there may be an intrauterine growth restriction to the baby. And there could be a lot of residual effects to your own health after even delivering the baby. So it's very important that this is treated during pregnancy. So then restless leg syndrome, what is it? If you don't know what restless leg syndrome is, you probably don't have it. But basically it's this energy or this sensation where you need to move your legs. And this is very much more prevalent in the evening before you go to bed. You may feel like a sensation of itching in your legs, and it's only relieved when you do move your legs. And for some reason, this is very common in pregnant women. It's actually 6% of pregnant women in their third trimester. And reasons for this could be a decrease in folic acid as well as iron. It could be that the hormone levels are increasing your chances of developing restless leg syndrome, but this can also lead to a lot of daytime fatigue, in general, poor sleep quality, insomnia, and as a result, just a very exhausting pregnancy. And lastly, insomnia. So I do get a lot of women that come to my clinic. I can't sleep, and there's a lot of reasons for this. It could be physical illness, it could be pain, it could be that, Gerd, and the hormonal changes also has a role, again, in your sleep-wake rhythm, and that gets disrupted when you're pregnant. The fetal movements could also keep you up or wake you up. And then, touching on obstructive sleep apnea, the inadequate respiration could also be keeping you up. So everything is kind of tied together, leading to poor sleep. And of course, when you're pregnant, there could be a lot of stressful things going on in your life that could also play a huge role in insomnia during pregnancy. So what is the treatment for all of this? So treatment is very much individualized, and we take a multidisciplinary approach, and we work with your OB-GYN as well. During pregnancy, there's not a lot of medications that we could be giving for insomnia or restless legs. So a lot of this, we need to be creative in our ways in treating this. If you do have symptoms, of obstructive sleep apnea, such as snoring, frequent awakenings at night, it is recommended to possibly get a sleep study, and highly recommended that if you do test positive for obstructive sleep apnea, to have it treated. And first line therapy would be CPAP. Usually during pregnancy. We could also try some, positional therapy if that works as well. And then we would also do some labs. And then for research has shown that cognitive behavioral therapy is very beneficial for insomnia in general during pregnancy. But because of the limited, 10-month pregnancy course and the schedule of a lot of our women, a lot of times this would have to be a bridged version. So that would be my presentation today.
Great, thank you. So informative. Can you explain the Gerd? So I know that Gerd is a symptom of sleep apnea or a complication of sleep apnea, but when you're pregnant, you get that anyway, right? So is there like a relationship with the OSA and the pregnancy and the Gerd, or is the Gerd more symptomatic of the pregnancy?
Yeah, great question. All of it is related, and Gerd, it's more prominent for two reasons. The first reason is the change in hormone levels. When you have an increased estrogen as well as progesterone, the sphincters that kind of close your stomach from your esophagus is more loose. And as a result, food particles or acid has an easier time traveling up. And the same hormones play a role in causing more edema in the upper airways to cause obstructive sleep apnea. So it's all related.
Interesting.
And the second reason is obviously, as you can imagine, if you're pregnant, you have a pretty big, stomach area, and all this pressure kind of presses up. So that also puts a lot of pressure in the GI system that causes the Gerd.
And the apnea itself kind of creates that negative intrathoracic pressure too, right?
Correct.
Okay.
Yeah.
It's so interesting to me how many people don't understand that like these things are related. The gastric reflux disorder is related to sleep apnea. Even in a family practice world, like you're in the family practice world, and it's so interesting to me how many internal medicine physicians and family physicians miss that component. Even the digestive disease doctors, they're not teaching people that these symptoms are related. And I've been in sleep medicine for, over 30 years, if you count my respiratory stuff, just because I was always so fascinated with the physiology of respiratory and sleep. And that makes sense,
It's all tied together.
Yeah, it's all tied together. Well, I just want to say thank you so much. If anybody has any questions, please feel free to comment on my Facebook Live, and I'll get back to you. You can email me at laurie.l@valleysleepcenter.com, and Dr. LuLu will be here August. So if you guys want to see her, we'll set you up an appointment. So thank you so much. And I wish everybody a beautiful evening.
Yeah, thank you for having me.
Bye.
Bye.